Hello.
Hey, how are you?
Good. How you doing?
Oh, well, thank you.
Good. A lot of questions.
Good.
Can I throw them at you? Sorry, I can't hear you. Weird.
Can't I
Can you?
can hear you.
Okay. Okay. There we go. Okay, we're good now.
Is
We're
that
good.
better? Okay.
Yeah. Okay. So, do you think non-essential retail will be closing soon?
No.
Sorry.
No.
No. Oh, sorry. Your audio is cutting in and out. That's weird.
You know what? Maybe I'll try it without the ear pods. Let me
Yeah.
see where I
Sorry.
put those.
I
See
hear
if
you
I.
every other word.
Ah,
Don't
there they
worry.
are. Hang on. I'll get rid of them. I'll get rid of them. Maybe it'll be better. Okay.
Our
Hear me now? Is that
perfect.
better?
Okay. Let's do this again.
Okay.
Okay. Do you think non-essential retail will be closing soon?
No, because this is leading into Black Friday and the Christmas season, and this is when retailers certainly, you know, make their revenue for the entire year. But I think
Yeah.
there will be more restrictions in place. I think
Okay.
that we will ensure that there's the proper safe physical distancing in place, so the 4 meters per patron per client, and certainly there may be limits on the malls and better monitoring of face coverings, etc. I mean, certainly I know that at the health table that
Yeah.
where all the public officers sit along with Dr. Williams, they give him advice. And there has been some discussion around that, um, with respect to will retail close, will restaurant patios close? And at this point, and it could change. At this point, the answer is no. Now, next week, if things don't stabilize, the answer could be yes, right? So I'm
Okay.
asking everyone once again to do their part. Now, Mississauga's starting to stabilize, which makes me very happy, but Brampton's not stabilizing yet, so I'm not happy because, of course, we're one public health unit. So what impacts them impacts us as well. And we also know that whatever policies are implemented need to be implemented region-wide. So not only Mississauga, Brampton, but Toronto as well. Like there was musings about lockdowns. And of course, I asked the question, what would that look like? Got noise coming in, sorry. What would that look like? What are the indices that would take us into a lockdown? What, are the benchmarks? How many cases, what positivity rate, et cetera, would that mean? Cases per 100,000, obviously. And those numbers are coming out tonight. I kept texting Dr. Lowe, do you have the new numbers yet? Do you have the new numbers? He said, yeah, in an hour or so, Mayor Crombie. So I thought, I wanted to have them for you. So what are the indices? And they're not well defined. And so as a result, I think we're holding, just waiting and watching the numbers. And of course, I'm really concerned because of what we saw on the weekend with Diwali. But Mississauga's holding steady. We had according to our numbers, we had 100. We've been holding steady around 100 now. Um,
Pardon the expression, but I know so there was a 19% positivity rate in Brampton when one of the neighborhoods, and pardon the expression, but we are in bed with Brampton. So no matter what happens, we have to support Brampton. So at the end of the day, what are your thoughts on this 19% positivity rate? I think it was in the Castlemore and McVean area.
Right. So, best to ask Mayor Brown.
Okay.
I'm not as familiar with each neighborhood in Brampton. If you had told me that was Malton or Bloor Dixie, I would have explained to you what the demographics look like, that people live in high rises and their professions are largely precarious and they have to go to work and they probably work in, blue collar types of employment where they're required to go to their places of employment, don't have and riding public transit and don't have the option of working from home like many of us do. So our average daily cases are 115. They've actually dropped over the past 4 days, 199, then a blip, 137, 82, 146, 111. They're in and around 115. Brampton's are 270,
Yeah.
and they'll be higher. They'll now be higher with when the new numbers come out. And so the average cases in Peel is 400. 400. Now, when we look at positivity rates, it's important to know two things. Number one, we are testing less. There are fewer people coming forward. We have a greater capacity at the assessment centers. than we're using. They could test, certainly Trillium Health could test 1,000 to 1,200 a day. They're only testing about 800. And Brampton, the same. They can test 1,700, 1,800, and they're testing fewer. But that's just based on people who come forward. We're telling people to go to the assessment center if there's a high probability that you have COVID because you're symptomatic or you've been exposed to someone who has been. So of course we have higher positivity rates because of the way we segregate people. If you're non-symptomatic and you need a COVID test because you want to return to work, return to school, travel, visit a loved one, a long-term care facility, you've gone to a pharmacy to get tested, right? True. And so it does make sense that positivity rates are higher, but they're not supposed to be more than about 4.5%, and ours are, so Mississaugas are 7%, Peel's are 10%, and Brampton's are 13%.
Okay.
So they are high. Caledon's are high too. Caledon last week had 9% positivity, so higher than even Mississauga's.
So let me ask you this then. I mean, there's still so much confusion in regards to this color-coded COVID-19 response safety mechanism system. I don't even know what to call it. But how long is Mississauga going to be in this red alert?
Until numbers stabilize, I suppose is the quick answer. But we said we would look at things in 2-week increments because it takes 2 weeks. Let's be honest. 2 weeks after Thanksgiving, we know that people were gathering because our case numbers shot up. We know that there were house parties at Halloween. Our case numbers are up, and now we're worried about Diwali. So it's every 2-week increments because that's how long it takes for the virus to present itself. So at least 2 weeks, and we look at things in 2-week intervals. But then we have the added complication that, what happens if we're stable and Brampton's not? Can I make a case to the Premier to say Mississauga's stable? And he's going to say, well, Mayor, that the virus travels. You said so yourself. And anything we implement should be region-wide, and it should be. But, I have a lot of businesses who are telling me they're suffering, and I will certainly try to make the case. 2 weeks ago, we were averaging 55 cases per 100,000. And I want to get that lower, and now I'm averaging 115 and saying, yes, I'm almost under 100.
Well, let me ask you, have you made the case to the Premier in regards to opening Mississauga?
So certainly I have mentioned it to him, and he said, well, we'll continue to watch it. I mean, if there's a big disparity, he will take what he calls a targeted approach or surgical approach. He hasn't done it very often. I mean, the last time I recall him doing it is Windsor, Essex.
Yeah.
Right. So different circumstances in each as well. So I don't know. The answer is I don't know. I'll certainly make the case when it happens. And if it's any sort of incentive for people to be more vigilant, that I can make it happen. If they lower the case numbers, let's do it. I will certainly drive that case home and be at the Premier and make the case to the medical officer of health. So, I mean, the numbers are higher in Brampton, and we both know that there are reasons why that is. I know Mayor Brown's been on your program, explaining that to everyone, and it's the type of employment, it's the type of socioeconomic circumstances, it's also large households, right?
Yeah.
And we understand, in fact, it's the subject of the cover story in the Toronto Star today.
Yeah.
If you saw it, right?
Yeah.
So there are special circumstances, but nonetheless, if there's a wide disparity, and there has been, they've been, 2 to 1 for our cases, but I'd still like to see, under 115 new daily cases, right? I'd like to be back to where we were, 40 cases per 100,000, and right now we are 74 per 100,000. So we have to cut them in half before I even have a shot at making the case.
Dr. Williams said, I think yesterday, was that he'd like to see all the regions in green for Christmas.
We all would, of course.
But do you see this being realistic, or do you?
Not at the way things are going. Yeah. I mean, if we took the kind of approach Melbourne did in Australia and lock everything down for the next 3 to 5 weeks, 6 weeks, maybe. But, if we don't,
No.
Not at this rate. Not at this rate.
We know like a lot of the cases in PO are coming from gatherings, workplaces, and households, which suggests there might be a broad economic lockdown. If this does happen, will you and Mayor Brown go up to bat for small businesses, knowing that it really doesn't come from kind of the restaurants and the gyms and those type of outbreaks?
Right. So we have been making that case to Dr. Williams, both of us. But at some point, they're going to evaluate people's lives versus their livelihoods. And, once again, we see it creeping into the long-term care facilities. I have 11 homes in outbreak where I have those numbers, 11 long-term care, 5 retirement homes, and 4 group homes in yellow, 1 long-term care in red, which means 90 residents and 60 staff are COVID positive. It's pretty bad. So the transmission has changed a little bit too. The best place for me to find that for you is, I'll try this, 46% of cases acquired through household contact now. So that number has grown significantly,
Okay.
right? Because it used to be, around 40%, 30%, 35%, 23%, so almost a quarter through community, just community spread. 14% through close contact outside the home. That's basically community spread too. 3% workplace. That remains pretty constant, that 3% workplace. 4% through travel. And major drivers, let's see, celebrations and weddings are a major driver of COVID in Peel. And we know that there have been wedding receptions that led to many, many positive.
There's schools in there?
I have the school numbers.
Well, this is actually a good segue because a few weeks ago you mentioned something about schools, about
Monday,
rumbling.
I think.
I know, a rumbling that you heard.
Last Monday?
Yeah, it was all over the news. Anyways, and then today, Minister Lecce mentioned that this might be happening. So, have you heard more?
Either I have really good sources.
Well, it sounds like you do.
Or it's the obvious thing to do, right? So schools, I have the school numbers. In Mississauga, there are 11 outbreaks, 23 cases in schools. In Brampton, there are 14 outbreaks and 35 cases, and then Khaled. And so total in Peel, 26 outbreaks and 62 cases.
Okay.
I don't think any classrooms or schools have been closed, just the children have been removed and isolated.
So I guarantee you, everybody that's watching right now, I bet you 95% of them have kids and they want to know, are schools closing earlier or are Christmas vacations starting earlier?
I would think that's more likely. So I don't know anything for certain.
Okay.
But, but it does make sense, right? And I think they want to go in and close the schools and get them cleaned and give it a little bit of a rest. So if it were me making those decisions, I may close a little early and bring them back a little later. That's what I would do, and I expect that's what we see. What we will see an announcement around. Now, I don't know anything for certain. It's speculation. It was speculation then when I said it as well. However, we know that it's possible. It's one of the tools at our disposal, right? One of the levers we have.
With everything that's changing, like literally on a dime, how does the municipality cope with all this uncertainty? Like, how do you guys switch on a dime? Like, or is it just kind of like you get thrown something and then you guys kind of go, okay, let's roll with it? Like, how do you guys deal with it right now?
So we have a lot of conference calls.
Okay.
We have the emergency response team meets twice a week, Mondays and Thursdays. And we have the Peel Public Health team, which includes public health, our hospital partners, the mayors, and the CAOs, and then the REOC, the regional response team as well. And we meet twice a week as well, unless we need to meet more often. When there are abrupt changes to policy, we usually schedule a call immediately, and everybody gets together in the various groups. I'm part of both groups, so it's a lot of, we all are, all the mayors are. And then, as you know, the mayors talk, the GTHA mayors talk on Mondays, So there are a lot of calls and a lot of meetings, and our staff is nimble. So we have a policy team in place that involves our CAO and all our commissioners and our legal solicitor, city solicitor. So we can move it pretty quickly. We can open things up, shut things down pretty quickly. So we're very nimble, and we have to be to respond. What I will say to that is it doesn't help the public because it drives uncertainty and it's mixed messaging. So yesterday I participated in a resident association call with Lauren Park and White Oaks rather. And, you know, the questions like, can I go to a restaurant? Is there indoor dining? Is there outdoor? Can I go to the mall? Are the gyms open? So it's just been so much uncertainty. Nobody knows for sure because, and there's not consistency between regions either. So it's perhaps they were indoor dining in Oakville or in Burlington and Mississauga, only limit of 10 capacity. But as of Monday, Halton, Durham, York, Hamilton, Niagara all moved into, well, most of those moved into red. Orange was Durham and Niagara. Yeah, so, but the rules changed, and they changed, you know, based on the circumstances and the case numbers. We have to take action. So there's no clarity. Like 2 weeks ago when we have 55 daily cases, 40 per 100,000, we were about to go into the orange zone, and then we had a workplace outbreak. Right? And suddenly the premier said, no, based on the new indices, let's put them into red, which was fine. And then on the weekend, Dr. Lowe recommended further restrictions, right? So that it changed again. And then last week, which was a week later, the province changed the framework, which changed things even more, which is fine. You know, we have to be nimble to address the situation, but people don't know. People don't know. And I can tell because when I'm on the call with the residents and they're saying, so can we go to a restaurant this week? Can I go to my gym? They don't.
So have you heard any more restrictions coming down the pipeline this week?
It's very possible.
Yeah, okay.
I know that the medical officers of health are discussing it. And I, you know, Dr. Lowe referred to a letter that he and Eileen Davila have sent to the chief medical officer for the province, Dr. Williams, giving their advice. Giving their advice. So it is possible, and I don't want to talk about it until it's implemented, but it is possible, just based on the numbers being so high. There were, you know, what did they say in Brampton and Peel today was what, 400 cases? We had, based on our numbers, 421 cases.
Oh, well, okay. And I think Toronto had a record amount too, of 509, so. Correct.
So, well, see, again, our numbers are different than the provincial numbers. So, for instance, so our numbers today, which is all day yesterday from midnight to 11:59, 101 in Mississauga, 5 in Caledon, and 307 in Brampton for 421. The provincial number, so 421, the provincial numbers go from 4 o'clock to 4 o'clock. So 4 o'clock the day before to 4 o'clock yesterday, and our number was 256.
That's so confusing.
That just means that tomorrow, all the numbers from 4 to midnight will be captured and their number will be higher, right?
So confusing.
It would be nice if we had the same metrics.
Yes. Yeah.
But it would be, and we've spoken about it many times. However, Dr. Lowe prefers that we go the full day, and I don't blame him. I don't know why the province does it 4 o'clock to 4 o'clock, but they do.
That's what time they get off. I'm just kidding.
It may be. So, I think people are working pretty long hours. I know I didn't get off.
I'm sure they are. I'm kidding.
Yesterday.
I'm kidding. Premier for it. I know you do F45. How, I'm sure you've talked to businesses, you know, how they.
Yes, they quick to call me or text me for sure.
Yeah. How are they doing? What are they saying?
Well, like, restaurants are worried, right? Because they can only have 10 capacity, and pretty soon it's going to be pretty cold sitting outside in a tent, an environment that has 2 open sides. And the gyms too. Right now we can use the gyms, and we have been limit of 10 in a class, and it's based on a cohort system, so you pre-register, and that's fine. That's fine. And we have council tomorrow, so we have a number of groups coming before, or general committee, but same, coming forward to talk to us about the restrictions.
Okay. This past weekend was Diwali, right? It was. I've never seen so many fireworks in my neighborhood, and it was an amazing firework display. But did you guys give out a lot of tickets this weekend?
No. So I have it all here. Pulled it up because I knew you would ask. So I was on texting with Byla all weekend, particularly Saturday evening, and I was watching CP24 and saw what was happening in the Gurdwara up in Brampton. And so I immediately asked what was going on with our Gurdwaras, and the largest one was closed.
Okay.
Dixie was closed. Malton, they went and checked. They had exactly as many people as were supposed to be inside, 10. And there were a few people with face coverings, I think just greeting friends, family, saying goodbye, and dispersed quickly when Bylaw said, "Hey, what are you doing?" And they all quickly left. But there weren't too many, but there were some. There was nothing like the situation we saw in Brampton. And then we did have a lot of calls that there were fireworks, but if you're with your family, you can light fireworks, right? You need a permit to light them in the park. I don't think they gave out any fireworks because it's very hard to pinpoint exactly where it is, and by the time they get there, it's finished anyways. So those are hard. So last week we had 167 complaints, 82 for businesses, including masks, 76 for gatherings, 9 for city parks facilities. So some of them, for instance, a barber shop that wasn't wearing masks, and they should know better. Friday, that was Thursday. Friday was a restaurant for exceeding limits and no physical distancing. Another not wearing masks in businesses. Pool hall that was open that shouldn't have been. So they were closed. They got into big trouble. Another restaurant that the bylaw had been there previously. No physical distancing, patio violations. Saturday, a restaurant exceeding indoor limits, no face coverings, no contact tracing, tent violations. And
So
yeah.
Are these places, like, do they ask why they didn't do it, or they just kind of, I don't care, I'm not doing it?
Well, that's when you get into trouble.
Okay.
That's when you get into trouble. If you say, I have a policy in place, and I guess I just missed that they didn't do it, well, I'm very sorry, we'll be more diligent next time. No problem. It's an education exercise. If we're like, well, these people don't want to, and we don't understand why we have to enforce it, then yeah, you're going to get a ticket.
True. Last question. Should I assume that all the holiday events, tree lightings, New Year's Eve, everything that the Celebration Square, the incredible events that are put on there are canceled?
No. See, it's funny you should say that. That came up on a call today. I'm assuming that New Year's Eve fireworks will be virtual. I will confirm that tomorrow at council. I'll ask the question. It's the right thing to conclude. I do have a tree lighting this weekend, but you know what? I just have to go to the square. Somebody will be there with a camera. I will press the button. The tree will light and we leave.
Virtual.
That's it. It's virtual. It's
okay.
virtual. So that's nice, but that's it. That's unfortunate. So, we are going to approve some Christmas markets and the ability to have outdoor gatherings, small markets tomorrow at General Committee. But I doubt you'll see one at Celebration Square because it would attract too many people.
True.
Right? If it's the small one in Port Credit, like they often do them in Port Credit or in Clarkson or in Streetsville, if it's a small market, fine, outdoor market. But if they're attracting too many people, it's going to be problematic.
Well, Mayor Crombie, those are all my questions. Is there anything else you'd like to talk about or say?
I think things are in flux. If I could just ask people to please continue to be vigilant. We're starting to plateau and starting to bring down our numbers here in Mississauga, and it's so important for our local businesses, our local retail establishments, our local restaurateurs, our gyms, all our small businesses. We want them to stay open, but that's incumbent on you to follow the rules and not gather so that our case numbers don't escalate. So please, just asking everyone. I know there is a lot of COVID fatigue out there, but unless we follow the guidelines, we see the result. We can track 2 weeks to the day after Thanksgiving, after Halloween, how case numbers started escalating. And so we know. So please, please do your part. Everybody has to do their part to stay safe and protect everyone else. Protect our elderly who are living in long-term care homes, where we're seeing COVID cases are now starting to enter the long-term care and the retirement homes once again, and protect our small businesses. We want our restaurants to open fully. We don't want to have to close down malls or retail right ahead of Christmas, their prime shopping time, their prime revenue generating time over the holidays. You know, we know that we've been at the provincial and federal government to send the financial relief. Apparently there's a bill that's stuck in the Senate. We need to get the money out, get the money flowing. So hopefully that'll come into place. But if everybody does their part, you know, we'll get this under control, and maybe we'll have that green Christmas.
I hope so. So, well, Mayor Crombie, thank you so much. Just letting you know that our videos, our talks since April weekly, have been seen by 1.25 million people so far.
That's fantastic. All right,
anyway.
Which mayor has the highest ratings?
You do, actually. Mississauga's been around the longest, right? So yeah, Mississauga, then Mayor Brown, then Burlington, and then Hamilton. So yeah, okay. So yeah, you got the highest ratings. Okay. So I'll see you next week.
Thank you.
Okay, see you later. I don't know how to come. This is a new system here. I don't know how to stop this. Uh-oh. They're like, I okay, yeah, you do it. Okay, see you later. Sorry.